Hammer toes, not hammer time. You got toes that are crooked, they're bugging you, they don't fit in your shoes. Welcome to Talking with Docs. I'm Dr. Brad Weening.
I'm Dr. Paul Zalzo.
We brought Danny Arora and Dr. Danny Arora, foot and ankle surgeon, to talk about hammer toes and what your options are. Welcome to the show.
Thank you for
Thanks
having
for
me
coming
again.
back.
Always a pleasure being
What's
here.
the name? Hammer toe. Can you come with something a little
Well, it's
less
kind of cool, no?
primitive?
Well, they talk about it, the deformity. The toe looks like a hammer. That's where it came from,
hammer
right?
toe.
Yeah. Okay, so let's talk about what it is, who gets it, and what the choices are. Because a lot of people are like, can I do anything for these, or do I just have to ride it out? There are a lot of choices, and it's a really wide variety of treatment options, and it really is a little bit of a dealer's choice.
Yeah, and
Okay.
I think the other thing too is that there's different, just to get fancy, there's a hammer toe, there's a mallet toe, there's a claw toe, and just basically
Really?
it's
All different kinds of hammers, ironically,
yeah,
right?
there you go. So it
You got
basically
a
just
jackhammer toe.
how does the toe look? Is it flexed at
Yeah.
the one joint? Is it extended? Anyways, essentially it's toe deformity,
Okay.
where patients can have that. They can have it in isolation, or a lot of times it's because there's another problem with it, right? And I think that's the big thing, is to identify, is there something causing the hammer toe,
Right.
or is the hammer toe in isolation? And let's just say isolated hammer toe, there's different ways of going about it as well. Is it a flexible hammer, like toe deformity, or is it a rigid or semi-rigid or rigid, right? When it's flexible, that's just more one muscle that's overpowering the other, causing, let's say, like the bend of the toe. So there's different ways to tackle that. So one would be, you could do some stretching exercises, proper footwear. So we tend to like a high toe box shoe to create a little bit of room so you get less friction.
Okay.
A wide toe box if someone has a bunion with that as well. And then there's other, devices that you could use.
Okay, so the flexible type is more of a soft tissue approach to treatment.
Yeah. So a lot of times it's because the curling of the toes. It could be because you're wearing really tight, narrow footwear, so that could cause the cramming of the toes. So you'd want to try to alleviate it that way. There are things that you could use for the hammer toes, like silicone sleeves. There's some bracing or splints that you could use to drop the foot when it's an extension. Those are just various devices that you could try.
So lots of options if you have.
Yeah.
And really, it's just like a tug of war, right, between the flexor tendon and the extensor tendon. That's
Correct.
what's causing this deformity.
And it causes that pull of the toe.
Right.
And the other thing too is if there's an associated thing with it, right, another deformity. And a lot of times what I would say is the majority of the hammer toes that I see have
the bunion.
It's the bunion.
Bunion.
Yeah, the bunion, the big toe, the bully
pushing
toe
over.
starts
Yeah,
to cram
the bully
it,
toe, I like
starts
that.
to push over the other toe.
Right.
The second toe or the one next to it tries to hike up because it doesn't like being pushed. You get that friction on the top of the shoe. There's usually that painful callus, which is that hardened skin. Sometimes people get chronic ulcers at that, and that's usually what drives us to fix the problem, and that means we need to fix the bunion, and then also then secondary, we'll fix the hammer toe or hammer toes. But essentially, like I said, if it's flexible or rigid, that's how we kind of devise the treatment option for that.
All right, and then the rigid ones, now you've got some bony
Yeah,
work
so
to
those
do.
are a little bit trickier, right? Because the toe is completely flexed and rigid. It's not moving. The joint is really, really stiffened up. So there's not a whole lot of stretching you could do with that, right?
Right.
The bracing doesn't really help too much because you can't really straighten the toe because it's
Right.
stuck in that position.
Yep.
Sometimes the silicone sleeves help because that'll just decrease the friction so you don't get the rubbing on the top of the toe, but definitely a high toe box shoe, a wide toe box as well to create room in the foot. Or this is where we sometimes have to treat it.
Okay, and so surgery-wise, just for the patient, do they have to do something with their hammer toe?
No. So
No.
again, if you got crooked toes,
Yeah,
you
and
got
you're
crooked toes. If it doesn't hurt, then it doesn't matter.
Just let it go.
Yeah.
Okay. Okay, so you got to the point where either you feel like you need surgery or you want surgery. Let's talk about surgical options for
Yeah.
the hammer toe.
So let's just say forget that there's another problem, right? Let's just say hammer toes in isolation or a toe deformity.
Right.
There's different ways to tackle it. Again, if it's more of a flexible thing, sometimes we just need to release a tendon or lengthen a tendon just to get the toe to be straight. Sometimes it's a bony problem where we have to like break the toes to change the alignment where we got to straighten the toes. So there's little various osteotomies that we do for that.
Right.
There used to be a classic way we used to open everything up, fuse the PIP joint or the joint where that flexes down.
Yeah.
I did a bunch of those
Yeah.
like 20 years ago when I first
Yeah,
started.
and we still sometimes do that, and sometimes
Yeah.
have to put pins across
Yeah.
the toes to hold it, and we sometimes have to do that as well. But I think the big thing that now has changed a bit of our attack to manage this surgically is a more minimally invasive approach.
Yeah.
And I think we've gone through a lot of MIS surgery for foot and ankle. especially in the forefoot and for the toes. So we do things through little poke holes. Any tendon work or even osteotomies where we have to break the bone to realign it is done through little poke holes. Right. So that's really limited how much we need to, do from a surgical incision standpoint, so less swelling. A lot of times patients can walk on it right away if we don't have to use the pins, and we could kind of get away with a lot of that, and patients are really helped.
So you're doing this so they're not usually leaving the pins to hold it fused for 6
Correct.
weeks anymore.
Yeah, so hopefully, like if we don't have to use the pin, then they could walk on it. Usually we could use hold the toes in the corrections with tape.
Okay.
That's my approach sometimes after doing the surgery. But in some cases where there's really significant deformity, very rigid toe, or we're doing a lot of releases, the pins are required where it just holds it in position while it heals.
Okay.
Yeah.
And that's about a 6 week or 4 to 6 weeks before you pull those pins out?
Yeah, so somewhere between 4 to 6 weeks, then we pull it out in clinic. Patients can sometimes walk on their heel when they have the pin sticking out of their toes. But obviously, if that comes with other, risk of infection because you have hardware sticking out, we try to avoid that if we don't need to.
Okay, so these are fairly common now. Crooked toes are common.
There's a lot of crooked toes out there.
Yeah.
Trust me, I see a lot of them in my office. Again, doesn't mean everyone needs an operation. Right. I think the symptom is what drives us to either do something, whether it be treat it or even manage it. Treating it meaning doing something with an operation to fix the problem, or just managing it with the various things, whether it be the shoe wear, footwear, or the splints and spacers.
Have you been practicing long enough now that there's no toes that surprise you? Like when someone takes a shoe off, do you ever still go?
From time to time, there's a few, but I think I've seen quite a lot of interesting feet.
Little question. So what if you have like a more generalized condition? So say if you have like Ehlers-Danlos, or if you had Charcot-Marie-Tooth, where there's like muscular imbalances or laxities that cause like multiple deformities. Yeah. Does that prevent you from being a candidate for these kinds of operations, or make them?
No, I think that's definitely something to consider, right? Okay. I mean, we're talking in isolation here, right? But obviously the full picture needs to be taken into account.
Okay.
If there's more of a generalized muscle problem, then just doing one toe in isolation won't help the problem. Sometimes you have to do a little bit more tendon work releases, or sometimes you have to be a little bit more aggressive in going for that fusion of the toe.
Right.
Whether it be putting a pin, or sometimes we even fire some screws. There's different ways to tackle the correction. And then, like I said, sometimes we have to correct the bunion to then correct the toe. So we got to make room for that second toe by moving the bully big toe out of the way, make it straight, so that the other toes have room to be straight themselves.
We all knew those kids in school too, didn't we?
And would you also say for these populations, is the main goal pain relief? Like obviously, cosmetically, the outcomes are going to be variable depending on the deformity that you're dealing with. So people might say, well, listen, I don't like how my toe looks, and you're like, well, we kind of have to decide, because it's not necessarily a cosmetic operation.
No, and we're some people do come in and want to fit into specific footwear, but I think this is not we don't do it for cosmesis, right? We want to correct the problem because there's a problem to fix from a symptom management, like pain, or like I said, sometimes they get that painful callus, and that's what drives them to say, well, we got to fix the toe, right? They got the ulcer or the callus on the top of the toe that keeps rubbing in their footwear, whether it's work boot or whatever they do for.
Yeah, I was always taught you try and change the footwear to fit the foot before you try and change the foot to fit the footwear.
Yeah, but that's actually a good point.
Sometimes you just can't, right?
And a shout out to a guy that trained Paul and I, Dr. Lou Saunders. He was a foot and ankle guy in Hamilton. He used to always say, we're not in the pretty business. You know what I mean? So if someone comes asking specifically to make their toe look better, beware, because they might not end up happy. That's the tricky part. So when it comes to hammer toes, know that they're very, very common, but they can be debilitating. They can cause ulcers. They can be painful. There are solutions. So have a discussion with your family doctor or your local foot and ankle surgeon to discuss all these. And if you like this video, please like it, subscribe to our channel, share this video with your friend that's got toes that are maybe crooked.
And remember, you are in charge of your own health.
Thanks, Dr. Arora, for joining us.
Thanks again, guys.
It's awesome. We'll see you next time.